spray here.
Okay.
It's nice and refreshing. And you're going to feel a tiny pinch, a deep breath in, and a poke 1, 2, 3. There we go. Can burn just a bit on the way in. Okay, that's one side, a bit more cold spray. Okay, tiny pinch, 1, 2, 3. There we go. Usually takes about 3 minutes to kick in, so I'll check it before we do anything. So that's that. Okay.
It's so weird that because I can move it like this, but I don't feel anything in the toe.
Yeah, pressure you'll feel, but
It feels
pain.
like, no, it feels like it's not mine.
All right. Well, that local anesthesia works. I guess. So this is a tourniquet to reduce bleeding during the procedure. You want to watch, or you can, whatever you want to do.
I don't know. It's just like when I was little, it was very noisy to see what's going on. Yeah.
Okay. Let me know if you feel anything
Okay.
other than pressure.
Okay.
Doesn't hurt, right?
Mm-mm.
Okay. So just releasing everything up. Then we'll go underneath.
Still nothing.
All right, this should last a few hours. Numbing. So, I've also always found it easier to remove a whole toenail by cutting it in half, because then you have 2 smaller pieces. It looks like it just broke a little bit there. There we go. So now it should just very easily come off in 2 pieces. We'll see. Yep, there's 1 piece. Got it. Yeah, let's see if this one wants to come out. There we go. Got it.
And I don't have any baby nail comes from the bottom, right?
Baby nails?
Yeah, like something like from the root. It's nothing comes out.
No, there's nothing there.
Yeah.
So what will happen eventually is there won't be like a little divot, and here will just be nice, straight, normal looking skin.
Okay, and no
Yeah.
sensitivity, right?
No, there shouldn't be.
Yeah.
No.
Do you think I can stick the fake one? Or it's not recommended? Like
Well,
not
I
for-
don't. There won't be anything to attach it to, so it doesn't adhere.
It's not gonna
all that
stay,
well. It's not
probably.
going to stick.
It's okay.
Okay, so here's the chemical that makes it permanent. You ready?
Yep. It's not gonna hurt, right?
No, you're
Okay.
numb. I've noticed, like, even if people are like only partially numb, because sometimes we can't numb them up completely. Usually, this step
Yeah.
doesn't really bug them all that
Yeah.
much. So
And that's killing the root.
this is killing it. Yeah, it's a chemical burn. It kills the cells that give rise to new toenail.
Yeah.
So this will never come back ever again.
It's okay. Anyway, I lived 36 years with ugly nails, so I'll be alright.
Can you tell us again how much you were spending on pedicures?
I do the pedicures because of my ugly nail. That's all
Yeah,
right.
which you won't have anymore. So you're going to save yourself a few $100 a month, right?
Yes.
Oh, yes.
And like 1 hour and a half of my life,
Yeah.
to stay in the salon.
Ironically, this procedure is what, like 5 minutes?
Yeah.
And we're going to save you a few hours every month?
Yeah.
So we're looking for like a good 40 to 60 seconds of contact with phenol on the skin there. Just let it take effect. And then we just kind of flush it away. Make sure we don't splash ourselves on our eyeballs.
Do I need to do like a bandage every day, or it's gonna be all right?
Well, both. Bandage every day, and it will be all right.
Okay.
But we'll talk about post-op care. And
Okay.
in fact, now is probably a good time to do that. So that looks pretty nice. It's nice and clean. Okay. So sometimes with removal of this tourniquet, it can bleed just a little bit. So here's the test to see. So put some pressure for a sec on there. You can see the toes pinking back up, so that's great. Okay. So this will put there. So I'd like you to keep this dressing in place for one day, so 24 hours. And then tomorrow you can remove it.
Okay.
Then a lot of patients get some relief with soaks. So warm water, Epsom salts for about 10 to 15 minutes or so, pat it dry. And what I would do is pick up some topical antibiotic from the pharmacy, Neosporin, whatever you have. And we'll actually use quite a decent amount on top of the skin where the nail used to be. And then you can just put a Band-Aid across it. And we'll do that every day.
Okay.
The skin underneath, I think in your case, this probably will not happen, but sometimes it turns a little bit raw, like a little superficial wound. But the nail wasn't really attached over there, so there was no trauma by removing it, so it's probably not going to happen.
Okay.
Either way, I would still use a decent amount of topical antibiotic because otherwise the dressing can stick, and it can be pretty uncomfortable to remove it. So, I mean, I don't think the topical antibiotic actually prevents infection, but you know, you should probably just have patients use Vaseline.
Something like that.